Health is about a lot more than the latest fad diets or workout crazes. It's about the air we breathe, the water we drink, our climate, our genes, and our access to affordable healthcare. On America Dissected, we cut beyond the headlines to understand what lies just beneath the latest trends shaping our health. Hey friends, I'm Dr. Abdul Al-Sayed. I'm a physician, epidemiologist, and county public health official. And every week, I'm talking to the doctors, scientists, culture makers, and policy leaders fighting for our health.
My name is Malcolm Gladwell.
I'm Heather McGee.
Senator Bernie Sanders of Vermont.
Alexis McGill-Johnson, President and CEO of Planned Parenthood.
My name is Tony Fauci.
And this is America Dissected. New episodes drop every Tuesday. Listen wherever you get your podcasts.
This Halloween, ghoul all out with Instacart. Whether you're hunting for the perfect costume, eyeing that giant bag of candy, or casting spells with eerie decor, we've got it all in one place. Download the Instacart app and get delivery in as fast as 30 minutes. Plus, enjoy $0 delivery fees on your first 3 orders. Offer valid for a limited time, minimum $10 per order, service fees, other fees, and additional terms apply. Instacart, bringing the store to your door this Halloween.
All told, U.S. companies spend more than $1 trillion every year on healthcare for employees and their families. That's more than 150 million Americans. It is a huge part of a company's budget. But what's the payoff for that big spend? Even many employees with generous health plans complain it's tough to find a doctor for affordable primary care. Workers are frustrated, employers are fed up.
Nowhere else in their business, they would say that it is okay to give worse and worse service and charge more and more. But we've allowed that in healthcare.
Several large U.S. companies are trying to fix the broken system themselves, giving employees low-cost primary healthcare right in the workplace. Today, a look at one big bank's plans to ensure its employees get convenient, regular checkups and other routine care, and why these experiments have stayed small. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. 30-year-old Lee Segraves, whose pronouns are they, them, prides themselves on being a problem solver in their personal life and in their finance job at the bank JP Morgan Chase.
Mostly I yell at spreadsheets. It's something different every day, lots of data, lots of analysis.
But one problem they've struggled to solve this year, why they were hungry, thirsty, and tired all the time.
My energy levels were so down. I was just so fatigued all the time. I was starving all the time. I'm like, I'm drinking more water. That's healthy, isn't it? And I kind of justified and normalized everything to myself because it came on so gradually.
Lee had health insurance through JP Morgan, but like an estimated 100 million other Americans, Lee did not have a go-to nurse or doctor they saw regularly for checkups. And the sticker shock of $100 for a single urgent care visit led Lee to avoid most routine care.
Who can afford that when you've got the flu? Like, no, I'll just lay on the couch and suffer, thank you.
That all changed for Lee last July. That's when Lee finally paid a visit to a clinic that the bank had opened back in 2022.
I hadn't been to a doctor in a very long time, so I was like almost chickened out. I'm like, no, this could potentially be serious. You need to do this. It's free. It's convenient. It's right here on site.
Employees could go to the lobby, get a cup of coffee and a quick health check that included basic blood tests, all on JP Morgan's dime. In 2021, the bank had launched an initiative called Morgan Health, with the purpose of investing at least $250 million in companies that are trying to help employers address their healthcare needs. The effort also has an arm that tests and pilots new health benefits within JP Morgan itself. That was how Lee could so easily get seen. The bank had contracted with Vera Whole Health to run 5 full-service clinics, complete with physicians, nurse practitioners, and mental health workers for its 35,000 workers and dependents in Columbus, Ohio. JP Morgan is placing a bet that over 5 years, this intensive preventive care will keep employees healthier and slow how much the bank spends on healthcare. And if they can pull all of that off, they think they can sell the model to other employers. Lee's results alarmed nurse practitioner Amy Cooper. She reached out to Lee immediately.
I said, listen, I would send you to the ER to get on an insulin drip right now because your blood sugar is so high.
Or Lee could come in to see her. Based on the results, it seemed like the 30-year-old had diabetes. Within 24 hours of taking their test, Lee was back in the clinic at work.
I was definitely a little scared. I was like, I now have something wrong with me, I guess, like that isn't just going to go away, that I can't just ignore or power through.
Amy and the team took their time with Lee, answered their questions, taught them to use a glucose monitor, how to inject themselves with insulin, and Amy says talked to Lee straight.
I didn't want to scare them, but I had to be honest with them. And I said, listen, I need you to take these medicines or your kidneys are going to die from diabetes and you're going to be on dialysis and your life is going to be shortened.
This is Vera Whole Health's philosophy. Treat every interaction with the patient as an opportunity for preventive care. For example, when a JP Morgan employee comes in with a sinus infection, Amy also makes sure that person's vaccinations and cancer screenings are up to date. It's what she did with Lee.
It's a shift in focus that we're proactive and not reactive.
Vera's goal is to help people better manage their health, under the assumption that when people like Lee do that, they can avoid expensive emergency room visits and hospital stays. Nurses ended up spending 90 minutes, an hour and a half with Lee, something that is virtually unheard of in most primary care offices around the country. Vera staff can do that in part because they're not paid based on the number of patients they see and the procedures they perform. Lee says that investment has paid off.
Here I am a month and a half later, able to stick myself with a couple needles every few days. And it's a big deal for me. Like, I'm also, fun fact, just a little bit needle phobic. And I'm also just like trying to be more active, trying to be more mindful of what I eat.
Lee's experience hits home for Dan Mendelsohn.
When you have an individual whose life is transformed, it's exactly why we're doing what we do.
Dan directs Morgan Health, and as pleased as he is for Lee, he knows the bank has plenty of work left to do to improve the health for the company's 285,000 employees nationwide and to tap the brakes on the $2 billion JP Morgan spends every year on healthcare costs.
Anecdotes are wonderful. It shows us that we're on the right track. But the ultimate test is whether they're improving outcomes and reducing cost.
Morgan Health is 2 years into its 5-year experiment. So far, a third of employees in Columbus have used the clinics, which Dan is pleased about. But he says the company needs more data to fully understand how much impact this program is actually having. When we come back, what research says about how much money primary care programs can save companies and the limits to this approach.
Health is about a lot more than the latest fad diets or workout crazes. It's about the air we breathe, the water we drink, our climate, our genes, and our access to affordable healthcare. On America Dissected, we cut beyond the headlines to understand what lies just beneath the latest trends shaping our health. Hey friends, I'm Dr. Abdul Al-Sayed. I'm a physician, epidemiologist, and county public health official. And every week, I'm talking to the doctors, scientists, culture makers, and policy leaders fighting for our health.
My name is Malcolm Gladwell.
I'm Heather McGee.
Senator Bernie Sanders of Vermont.
Alexis McGill-Johnson, President and CEO of Planned Parenthood.
My name is Tony Fauci.
And this is America Dissected. New episodes drop every Tuesday. Listen wherever you get your podcasts.
This Halloween, ghoul all out with Instacart. Whether you're hunting for the perfect costume, eyeing that giant bag of candy, or casting spells with eerie decor, we've got it all in one place. Download the Instacart app and get delivery in as fast as 30 minutes. Plus, enjoy $0 delivery fees on your first 3 orders. Offer valid for a limited time, minimum $10 per order, service fees, other fees, and additional terms apply. Instacart, bringing the store to your door this Halloween.
Welcome back. Before the break, we heard about how the clinic at the JP Morgan office in Columbus, Ohio had helped Lee begin to manage their diabetes. The promise of free care and the convenience of having a primary care clinic located right at work made it much easier to address their health. A growing number of employers who oversee their own insurance plans are beginning to offer their workers more preventive care. We've asked reporter Alex Olgin to look into this strategy of investing in primary care and how well it works. She joins me now to talk about it. Hey, Alex.
Hi, Dan.
So let's start by talking about why companies are bullish on primary care as a way to improve worker health and reduce overall healthcare spending.
Yeah, Dan. So there are really two basic ways that companies think investing in primary care could help employees and save money. First, they're cutting out the middleman, the insurance company, and agreeing on prices directly with the doctor or hospital.
When you have less hands in the cookie jar, it becomes much more affordable, less costly.
That's Matt Ort, formerly the head of human resources at Merrill Steel in Wisconsin. Merrill cut out the insurance company and worked directly with a primary care physician to treat 1,000 employees and family members in both their Wisconsin and Missouri facilities. Matt found that the combination of building an on-site clinic, paying a primary care doctor directly, and steering workers away from high-cost, low-quality specialists, he was able to save more than $5 million in 5 years. And he now runs a company that tries to duplicate that success for other firms.
So let's take a look at that for a second, Alex. On first pass, this sounds pretty counterintuitive because, of course, businesses hire insurance companies with the idea that the insurers will negotiate much better rates than they could ever get on their own.
Right. But based on my reporting, there's some evidence that working with insurance companies may have less value than you might assume. There are more than a dozen case studies of individual companies showing that they can get lower prices by going directly to the doctor or hospital. Then there are at least 3 other studies published in Health Affairs and JAMA that show that cash prices were lower than the insurance negotiated rates.
I see. And that's why Merrill Steel paid doctors directly. Is this a strategy that other companies are pursuing, Alex?
Yes, they are, but it's still a relatively small proportion of companies overall. Sean Greminger is the CEO of the National Alliance of Healthcare Purchaser Coalitions. The organization represents public and private employers that buy healthcare for 45 million employees. He told me there's enough return on ditching insurers that 20% of his members already work directly with doctors and hospitals. And based on the group's annual survey, 30% more plan to do so in the next few years. Sean thinks the pressure that companies are facing as prices continue to rise may lead to more businesses making the leap.
The fascinating question for me is the carriers. How are they going to respond to this?
What Sean is saying there, Dan, is that the carriers, the insurance companies, might start to feel the heat if some of their biggest clients start walking out the door. And he wonders if the Uniteds, Anthems, and Blue Crosses will do anything to sweeten the pot.
Okay, you said there were 2 ways companies think investing in primary care will save money. The first is contracting directly with providers. What's the second?
Paying doctors and nurses to spend a bunch of time with patients to help them manage their diseases. This is opposed to paying for every appointment, every needle prick, every service.
Like with Lee and their diabetes.
Exactly. At the highest level, the idea is to pay doctors and hospitals to keep people healthy rather than see a lot of patients. And that's where the primary care part of this comes in. Under this different payment model, providers have more incentive to focus on preventive and primary care. The buzzword, Dan, is value-based care, and people have been talking about it for 20 years.
Right, like what JP Morgan is doing with Vera Whole Health. Instead of paying per visit, providers get paid to work on managing patients' diabetes and high blood pressure and all the rest, and minimize expensive specialists and hospital visits.
I talked to the nationwide healthcare firm Premise Health that runs these clinics for hundreds of employers across the country. And they told me that they're claiming savings on average of 25% per person every year. One lesson that companies and health policy wonks are learning is that doubling down on primary care can help both employees be healthier and employers lower costs.
Okay, That makes some intuitive sense, if only because younger folks tend to be healthier and preventive care can help them stay that way longer.
You know, Dan, there's a lot of interest in these new payment models. The federal government has been testing them for over 10 years. So-called accountable care organizations have had some success. That's jargon for a group of primary care doctors and specialists who work together to prevent hospitalizations and avoid unnecessary tests. These deals have saved Medicare money for 6 years straight.
But the savings have been much lower than some had hoped.
That's true, and it's important to call out the limits of what primary care can do alone. Models that just increase funding for primary care are falling short. One of the nation's biggest, most ambitious experiments, we're talking a 5-year study with 17 million patients focused on beefing up primary care, turns out didn't save any money. Anne O'Malley, who works at Mathematica, a research and consulting firm, has spent 12 years evaluating these programs. And she says the reality is that 95% of our healthcare dollars go to other stuff like hospitals, surgeries, and drugs. So any program trying to save money needs to tackle those costs as well.
It's not an either or. It's important to both invest in primary care and at the same time reduce costly, unnecessary services.
Okay, Alex, so those are the two ways that companies think investing in primary care can help improve worker health and save the business money: contracting directly with doctors and hospitals and paying them to keep people healthy. But we've been hearing about those strategies and other efforts to try and solve this intractable healthcare cost problem for years. Even JP Morgan has tried to tackle it before, right? Like back in 2018, there was all that hype around that partnership with Amazon and Berkshire Hathaway.
Yes, that project was called Haven, but it ended up falling apart after 3 years. Honestly, Dan, there are plenty of reasons to be skeptical that we're on the cusp of some private sector primary care movement.
It takes a lot of expertise in employers.
Dr. Bob Galvin would know. He spent 15 years leading the change for General Electric, and he's now board chairman for the Catalyst for Payment Reform, an organization that helps employers be more savvy healthcare buyers.
They're making jet engines. They're doing software. The healthcare is not what they think about. So I don't think it's nationally scalable.
And Dan, Bob told me that even when companies like JP Morgan do make these big investments, it helps their own employees like Lee, and that's great. But it has the unintended consequence of exacerbating a two-tiered system, one where some employees get robust, low-cost primary care, and others are struggling to even find a doctor when primary care is already hard to come by. And I actually saw that up close myself when I was reporting this story. Remember Lee, Dan? Lee's getting a lot of good care for diabetes, right?
It sure sounds like it.
It's a totally different story for Lee's mom, Gwen, who also gets insurance through working at a clothing company and has diabetes too. Lee has had 5 appointments with providers over the last 3 months, all for free. Lee's mom only sees a doctor for 10 minutes every few months.
I've never experienced the medical field as anything other than we get you in, we give you a pill, and we send you on your way. And then if you're sick again, we bring you in, we charge you again.
Unlike Lee, Gwen feels isolated. No medical provider who's checking in or rooting for her, helping her. Case in point, Gwen has struggled to afford a glucose monitor to check her blood sugar. And that leaves her guessing whether she's high or low. Her doctor's advice: eat less chips and cut out the soda.
If you don't feel cared for, sometimes you don't care for yourself. Your morale's down. You don't feel good, so you don't eat dinner when you come home from work. That's not good, but you just don't feel good. And I think it's all part of feeling like you matter and that you are cared for.
Gwen thinks that if she had the same low-cost, high-touch care as Lee, she'd have her diabetes in check.
So, Alex, this is the two-tiered system. And so even if JP Morgan has success here, it's hard to imagine too many employers following their lead and getting deeper into primary care. At the end of the day, historically, we've just seen so little innovation.
Yeah, and that's how Bob Galvin, with a catalyst for payment reform, sees it too. He has spent years trying to convince companies all over the country to leverage their enormous buying power, and they largely haven't. A solution for more affordable care for everyone, he thinks, needs to be more heavy-handed, like the federal government stepping in and actually capping prices for surgeries or hospitalizations.
I think employers are going to get much more interested on the policy front that controls prices than they ever have been before. I think that's the next frontier.
Now, this is an idea that some healthcare economists have started to come around to as well. Whether limits on expensive care would lead to shifting more spending to preventive primary care, like what Lee got, is an entirely different question.
Thanks for your reporting on this, Alex.
You're welcome, Dan.
By the end of 2026, Morgan Health expects to learn whether its primary care focus experiment in Columbus is working, improving care, and saving J.P. Morgan Chase much money. I'm Dan Gorenstein. This is Tradeoffs. For the past 15 years, reporter Paula Spann has written the New Old Age column for the New York Times. Her goal? Help people age more on their own terms.
And one way I want to do that is to let readers know that they have more choices than they think they may have, medically and otherwise.
Choices like leaving that cancer alone instead of cutting it out, or dying at home instead of in the hospital.
I just want to give people the sense that, yes, you can question this, become knowledgeable, and have this conversation.
What Paula's learned about aging well from experts, readers, and her own personal journey into older age. Next time on Tradeoffs.
Thanks for listening to Tradeoffs. If you've just discovered us, remember to subscribe to the feed so you never miss an episode. Subscribing is free and easy on whichever podcasting app you use, the NPR app, Apple Podcasts, Spotify, wherever you listen to podcasts. The Tradeoffs team is producers Alex Olgin and Ryan Levy, editor Deborah Franklin, executive director Jessica Silverman, marketing director Catherine Dougal, audience engagement lead Shannon Crane with help from Kate Seepy and Cedric Wilson, sound designer Andrew Perella, executive editor Dan Gorenstein, and senior producer Leslie Walker. The Tradeoffs theme song was composed by Ty Sitterman with additional music this episode from Blue Dot Sessions and Epidemic Sound. Tradeoffs coverage of primary care is supported in part by the Commonwealth Fund. Additional thanks to Guy D'Andrea, Rivka Friedman, Holly Ron, Ann Greiner, Magda Rushanovsky, Raymond Tsai, Robert Berenson, Jeff Levenshires, Ryan Rupp, and Kevin Wang. Thanks also to all our listeners who helped to support our work, including Deborah Lindis, Tom Mendelson, Lee Silkunas, and Aaron Tobin. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, the Leonard Davis Institute at the University of Pennsylvania, and the National Institute for Healthcare Management Foundation. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.
If there's one thing that my family and friends know me for, it's being an amazing gift giver. I owe it all to Celebrations Passport from 1-800-Flowers.com, my one-stop shopping site that has amazing gifts for every occasion. With Celebrations Passport, I get free shipping on thousands of amazing gifts. And the more gifts I give, the more perks and rewards I earn. To learn more and take your gift giving to the next level, visit 1-800-Flowers.com/ACAST. That's 1-800-Flowers.com/ACAST.
There are some football feelings you can only get with BetMGM Sportsbook. That's right. Not just the highs, woo! The O's, or the no-no-nos. No! It's the feeling that comes with being taken care of every down of the football season. The feeling that comes with getting MGM Rewards benefits or earning bonus bets. So, whether you're drawing up a same-game parlay in your playbook or betting the over on your favorite team, the BetMGM app is the best place to bet on football. You only get that feeling at BetMGM. the sportsbook born in Vegas, now live across the DMV. BetMGM and GameSense remind you to play responsibly. See BetMGM.com for terms. 21 plus only, DC only, subject to eligibility requirements. Gambling problem? Call 1-800-GAMBLER.